Did you know that on average during your lifetime, you will have 9 surgical procedures? Fortunately, there's never been a better time in history to have surgery, and while we cannot eliminate the possibility of things going wrong, we can trust that patient safety is always going to be the number one priority. But that hasn't always been the case. We've come a long way since the earliest recorded accounts of surgical procedures taking place, back when the chances of survival, let alone recovery from it, were pretty slim. In the Victorian era, procedures were so gruesome, tickets were often sold to spectators. For surgeons back then, the larger the incision and the more blood on your apron, the more respected you were. For patients, this meant that if they survived the experimental procedures, they faced long, painful, and uncertain roads to recovery. Thanks to people like John Hunter, a Fellow of the Royal Society and an advocate of careful observation and scientific method in medicine, surgery transformed from risky art into a scientific discipline capable of treating many diseases and conditions. And while large incisions are still a feature of modern-day practices, particularly in open surgery, surgeons have adopted a more sympathetic stance toward patients. In the 1980s, we saw the introduction of less invasive techniques like laparoscopic or keyhole surgery, which involves making 3 small incisions on the patient's skin. The technique is far less traumatic for the patient, but can take a long time to master. Fast forward to the late 90s, and we see the introduction of robots to help make surgeons' lives a bit easier. While these surgical robots were still being controlled by a human operator, they could accurately replicate the surgeon's actions, so complex tasks became more manageable. What's more, robots enabled surgeons to do things that couldn't previously be achieved by a human hand. More recently, researchers at the Institute of Global Health Innovation's Hamlyn Centre at Imperial College London have gone a step further to explore how human vision can be used to control or guide surgical robots. Things like how the surgeon's eyes can be used as a 3D scanner to describe the inside of their patient in 3 dimensions and accordingly guide or restrict the actions of the robot, or visualize complex surgery in a way that's easier for the surgeon to work with and the robot to understand and assist. Our eyes can collect information about the world around us, while at the same time project so much information about our thoughts and feelings. Thinking about human vision in this bi-directional way has been important in helping us to understand when and how robots can best assist during surgery. By detecting concentration levels or by checking whether the surgeon needs to take a break, the robot can accordingly adapt its behaviour and switch to a higher safety mode. We're still a long way off seeing fully autonomous robots holding a surgical knife, with many technical, legal and ethical challenges to overcome. But as we look ahead, with more tasks being handed over to robots, it's important to consider who or what will be making the final decisions and where the ultimate responsibility lies. How confident would you feel knowing a robot surgeon was about to operate on you? Would you trust a robot surgeon?